Over 1,000 passengers aboard 8 flights arriving in the country on Friday, January 6, 2023, have been screened since the new measures to curb the importation of COVID-19 virus took effect. So far, about 15 passengers who have not been fully vaccinated were tested at the airport by the Ghana Health Service officials, and none of them, including those originating from China, tested positive. Our correspondent, Sarah Ofori, was at the airport today and has this report.
Passengers upon arrival are required to have filled out the Port Health Declaration form and present their COVID-19 vaccination card, yellow fever card, boarding pass, and indicate the country of origin, after which they are cleared to continue the arrival checks with the Immigration and Customs Services.
Because the online health declaration form is available to us at the time of your departure, we have on record the persons that would have to be tested. And using our surveillance system, we are able to pick you, once you land, because we know the flights you are coming with, we know the time you are coming, we know where you are coming from, and then we are able to, screen and pick you out, and then we take you through the process. The crew are treated a bit differently. What we do, as a service, Ghana Health Service, is that periodically we screen them, and the airlines ensure that they are tested periodically and they are vaccinated fully.
At the time of putting together this report, about 1,000 passengers aboard Delta, Emirates, Rwan Air, Ethiopia and Aska Airlines, among others, had arrived and screened. The screening process itself does not take more than 5 minutes.
I guess it's a routine where I'm coming from. You have to abide by that 6 feet and wear your mask and all those things. You see me wearing my mask. Yeah, I think it's kind of like a normal practice now. There's nothing new. We just have to abide by the rules and listen to whatever the health people are going to tell us to do, and that's what we have to do.
What was very difficult is they require the COVID test to be 48 hours or less, and at least in America, it's very hard to get a COVID test in less than 72 hours. So 95% of the laboratories and the doctors, you won't get your test in time. So you're forced to spend and pay an additional $200 to get a rapid test.
This passenger from the United States was unduly delayed because she was not vaccinated, although she had a negative PCR test result. But having gone through the mandatory test by the Port Health, her negative status was confirmed. So this is a sample collection center where passengers who have not been fully vaccinated nor have their PCR negative test results with them to test for COVID-19. I'm told that the average time or turnaround time for results to be ready is about 25 minutes. So earlier we had a passenger who has never been vaccinated. When I inquired from her, although she didn't speak to us on camera, she said she didn't need the vaccine, neither was there any need for her to carry any certificate indicating that she's been vaccinated or not, because it's optional. So these tablets displayed here are where passengers would come and have their health declaration form filled out before they continue with the process. Samples are received by the Public Reference Laboratory, where we are told enough reagents have been procured to test at the airport.
Well, if you check the Ghana Health Service Port Health Enhancement Program, we already have a plan to strengthen port health at the various points of entry, to include screening where possible using lab methods for health. So this is one activity that's enabling the port health to strengthen their capacity. And if you check, there's a program where 4 points of entry already have a lab capacity development program. So this is part of the process.
So far, none of those tested today, including those originating from China, tested positive for COVID-19. Sarah Ofori, GBC News, Kotoka International Airport, Accra.